As promised, welcome to another live session with me, Vinod James. Welcome to Neetu's Academy Reading Live. So today, as promised, we'll be coming with how we have to, or generally the live would be from here. I hope all of you were eagerly waiting. Yes, I'm sure that all of you were eagerly waiting, isn't it? What are the things that Neetu's Academy has in stores for you? We have an array of linguistic exams that we give training. You name it, we have it. That's how easy, the simplest way of explaining. No matter whatever that you want, please do let us know. We will always do a level best to make sure that we can infuse it into our academy. You can see that the next regular batch starts from Feb, March, April. That's how much of a trust that our students have in us. Because when they come to us, they know that we will push you to the extreme to make sure that you achieve your dream score. Because our motto is to make sure that we will be that bridge between you and your dream. And yesterday you have seen about 125 plus students who have made to their dream, isn't it? That's an absolute stunning amount of students who have made to their dream. Did you all see those lovely faces who have made, and the scores that they have achieved is absolutely stunning. Achu Nitin, good afternoon. Atiraj, Sally, good afternoon. So every time when the result pops up, it's an honor to come and say hats off to all of you lovely hardworking students because of your great effort. You know, you made us so proud about all of you. So hats off to each one of you for your great achievement. You know, you have scores which was there, like, you know, like dream scores which you can see. And I always love a student who gets it about, you know, writing. Anything about 350 is an absolute stunner. And there are students who have got 400, 410, 420. Lovely, lovely scores to read as well. Atira Prabhu, good afternoon. Sri Lakshmi Lechu, good afternoon. So nice to see all of you. As soon as we are there, you're all there to support us. So thank you so much for being our patrons. Anybody who's attending for the first time, please do let me know. And also, how many of you have seen those lovely faces of those students who are made to their dream? Clarina Fernandez, good afternoon. You always have to remember, those are all like us, normal students, and they have got such a kind of lovely scores, isn't it? Some of them are absolutely astonishing scores. Ashwita Bishate, Bangalore, good afternoon. Larina, good afternoon. So nice to see at least one icon next to your name. So if you have not yet liked our page, please do like our page. If you have not yet subscribed to our channel, please do subscribe to our channel so that you do not miss any important events or any information that we want to pass on. Anija Anil, good afternoon. Divya Albin, good afternoon. Sonia, good afternoon. A very, very, very good afternoon to all of you. So no matter whichever part of the world you are from, so a very good morning, a very good afternoon, and a very good evening to all my lovely students. Sangasudha, good afternoon. Shilpa Shibu, good afternoon. Right. And as we have just pinned, we have few channels available. We have few Telegram pages available. Any of those, if you have not joined, please do join. These are all free access for you. Now, why free access? It's for you to get exposed to the world of that exam. Sandhya Vishnu, hi sir, good afternoon. Abhijit Selvaraj, good afternoon. Preeta Shaji, good afternoon. Few new names, and there are few names where there is no icon. So if you have not yet liked the page that you're watching, please do click the like button. If you have not yet followed us, please do click the follow button. And also, if you have not yet shared the very same page that you're watching, please do share. And that's how I assess myself, because if the shares are more, I feel that you're feeling my classes are beneficial. If not, likewise. Rashna Suraj, good afternoon. So anybody ആദ്യമായിട്ട് ലൈവിൽ അറ്റൻഡ് ചെയ്യുന്ന ആരെങ്കിലും ഉണ്ടോ? Is there anybody who's attending the live for the very first time? If so, please do let me know where you're from as well. I would be happy to know where you're from. Vijay good afternoon. Prince Joe, good afternoon. Uttam Kumar, good afternoon. A lot of, new names as well as a mix of renowned names that I know. Srimol Mohan. Okay, thank you. Because of your lovely support, you can see whether you take the very same page that you're watching. We have n number of students on a daily basis. It is improving. We have our Telegram page, which is always hovering about 49 plus students there. That shows the support that you are showing towards us, and that shows that you're all so be after a long time. Good morning. I hope your Christmas, the festive season is all there and it's all freezing out there, isn't it? Akila Sham, good afternoon. So lots of people, some I know where you're from, that's the only reason I'm just, that knows a bit more, that's all. Good enough. It's not that I don't know the others, okay? I can't remember all those people. So, Kavita Vijayan, good afternoon. Right. So tell me, did you all see those students who have made to their dream that lovely, huge list which was there? Abhiya, good afternoon. Chinju, Switten, good afternoon. Sarah, good afternoon. Srichitra, good afternoon. Mumtiz, good afternoon. Neetu Mol, good afternoon. This is my first time. I'm from Kottayam. Thank you very much, Neetu Mol. So Neetu Mol from Kottayam. Vinita Shaiju, good morning. Could you please explain what's the main difference between 8 to 14 and 16 to 20? Need to use an article 8 to 15. I'll be telling you once I start telling about that. When we are doing part, I will be telling that. Yeah. Who's that? Vinita, right? Yeah. Alfina, good afternoon. Suresh Kevin, thank you, sir. I passed my exam with your guidance. Thank you very much, Suresh. But let me remind you, it is all your hard work. We're just the bridge. We're just the stepping stone where you just step on and go reach your dream country. So happy that Suresh have taken that much of a busy time to come and let us know, and also taking us the part, giving us that small part on the aspect of clearing. So Suresh would be kind enough to tell me what are your scores, so that it's another catalyst for all my other students who are there, who will be also telling to themselves that, okay, I will also tell one day that I have made to my dream. Good enough. So congratulations, Suresh, on a great achievement. Absolutely good enough. So proud of all of you. Renita, good afternoon. Kavita, good afternoon. Mumtaz, take all these happiness. We're all happy because we consider all of you as our family member. Good enough. So Suresh have made to his dream. Good enough, good enough. So likewise, you are also going to be there telling me one day that I have made to my dream. I'm sure it will be. Excellent. So as what Suresh was saying, it's just a morale booster to each one of you. Because why? You can also one day come and tell me in the very same page that you're watching, I have made to my dream. Good. So as our students are piling up, and there was only one person, Neetu Mol from Kottayam, is what the only newcomer is, what as far as I know. So we'll be looking into two things. What are the two things that we'll be? We'll be talking about a part B, where the question would be shared today. Okay, then you'll be given 2 minutes of time. And in that 2 minutes of time, you're expected to find an answer. Annie Davis here. Hope you're enjoying your lovely weather wherever in your dream country, isn't it? Annie Davis is always so kind to come and greet in between. Nice to meet you, Annie. Good enough. Sarah Rennie, yes, sir. We also can make our dream. I'm sure, Sarah, you would come and tell me that I have made to my dream. Soumya Joseph, good afternoon. A very, very, very good afternoon to all of you. So as always, I'm so happy that students come and say, yes, I made to my dream. And it's due to their hard work. Of course, God's grace, and it is their effort. We are just that small part, just that minute part between the thin line between you and your dream. Soni Raju, good afternoon. So as again, it's happy because all my lovely students, a lot of students have cleared. So happy for them. Now the next thing is you are also going to write the exam no sooner, and you will also come and say, I have made to my dream. I'm sure there is no question about it. Okay, because you're all hardworking students. Now, my job is to make sure that I just give you some smart work as well along with that. So if you're ready, please do let me know. If you're ready, please do give me a thumbs up saying that I'm ready for today's session, because so that I can show you the part B material on the screen. Are you all ready for today's session? If so, give me a quick thumbs up. Let me see how many of you are ready, because active participation is one of the most important things for us as well as for you, because you need to come out of that comfort zone. Soumya ready, Abhiya ready, Divya ready. Good enough, good enough. Sangasudha ready. Sonia ready. Excellent. Because you have to say, we are here, we Sarah ready. We have to say, see, I'm here with a purpose, isn't it? My purpose is to come out of that comfort zone. Enough, I'm gonna learn. Abhijit ready, Sobi ready, Renita ready. Right, Alfina ready. So as you're all saying you're ready, Achunit ready. So the question will be popping up on the screen. Mumtaz is ready. As soon as the question pops up on the screen, do not waste your valuable time. Do find an answer. Once you find an answer, just say done or put a thumbs up. That's all I need to do. I'll ask you when to type the answers. Divya ready, Sonia ready, Jinju ready. There you have the question. Please do the material. Uttam Kumar ready, Kavita ready. Okay, fair enough. Please do, and then we will discuss. Ramya Gobi, thank you for the class. Good morning. All right, time I've just alluded. Sri Chitra was saying ready, Rasna saying ready, Shalit ready, Tina Antoni, good afternoon, Ashwita ready, Anita ready, Anu ready, Shibianto, hi, Ashley Joes, good afternoon, Eben Worky, good afternoon. After some time, Eben, nice to see. Tina Antoni done, Soni Raju done, Eben Worky done, Binu Yohanan, good afternoon. I didn't want to miss any of your names. Ramya Gopi done, Tangasudha done. All right, good enough, good enough. Muntis, yes, done. Sobi done. Uttam Kumar done. Zara Reni done. Anita Prabhu done. Good. Sonia D'Souza done. Vijay done. Divya done. Good. At least, when you're commenting done, yes, completed, done. That's that learning curve that we're talking about. Kavita done. Sonia Beeman done. Atira done. Simi Nikle done. New name. So again, if there is anybody who's attending the live for the very first time, please do let me know. Just to add on to my known people's skills. That's all. And Abhijit done, Sandhya done, Saumya done, Renita done. All right. As you have all said, Sri Chitra done. As you have all said, done, done, done. Would you be kind enough to tell me what is your answer? Not just what is your answer, where you got that answer from. That where is very important for me. Ashley Joe's done. Because I always believe my correction should be from where, if you have gone wrong, from where you went wrong. It's not just about saying, okay, this is the answer, that is the answer. No, we don't believe in that. Okay. So please be kind enough to tell me what is your answer and where you got that answer. Asha Tom done. Now, what is your answer? Where you got that answer from? Ramya Gopi, B from the entire para, especially from assessment and recommendation para. Okay, fair enough. Priya Lijo, first time. Priya, would you be kind enough to tell me where you're from as well? There, my heart man is there. Selva Kumar, my dearest sir. Good enough, welcome. Sri Lakshmi done. Soumya Joseph B. Sonia C in the last three lines. Okay, now I have B and C. Ashley Joe C from the last para. Tina Anthony B from first line situation and last recommendation. Okay, fair enough. Vijishree B, last para. Okay, so B and C from the same place, is it? Achunitin B from the last sentence. Ebinwaki B from the entire para. Sinini Clay, again a new name. C. Abhijit B especially from recommendation. Okay, fair enough. Sonia D'Souza B from the whole para. Sarah C from the last part of the para. Anita Prabhu C from the whole para. Uttam Kumar C from first para. Okay, now see. This is where that difference is, isn't it? So the same place, you can get two different answers as well. Vinci Pradeep, good afternoon. Ashwita B, elimination, fair enough. Sri Chitra B from the full para. Fair enough. Shalit C from the last para. Alright. Priya Lijuam from UAE. So another person from a known list from United Arab Emirates. Thank you, Priya. Rashna Suraj B from the last sentence. So I have two people. Neetu Mol from Kottayam, Priya Lijo from UAE. Sobi B, Chinju Sweeten C from the last recommendation. Renita B, Bensi Pradeep C, Mamtis C from the whole para. Okay. Now because you have all said Preeta Shaji C, Asha Tom C, as you have said, whatever the answers are, now let's see what are the difference or what made that difference. Okay, Tango Sudasi. So the question will be popping up on the screen again. Before that, just let me remind you part C. Okay, see part B. Part B, you are expected to do certain things. First and the foremost important thing is, in part B, you're expected to read it along with the sentence. Okay, so first and the foremost important thing to do in part B is read the question. As you read the question, underline the key words in the question. It should be anything between 2 to 3 words. That's it. Not more than that. Okay. So keyword should be underlined. And then you are expected to understand the question. As you read, underline, understand the question. These are the 3 important things that you have to do. After that, you have 2 options. One, you can read the answer options, underline the keywords in the answer option, and then read the paragraph. Or you can read the paragraph and then pick an answer from from the given option. But I'm a person who always follows certain rules. So my job, because I need to know what I'm searching for in the paragraph. So I underline my keywords in the answer option, then only I go to the paragraph. So I'm just going to show you why it is important. See, 1, the question, the purpose of the safety notice about sharp injuries is to. So purpose, notice is to. Okay. Now when you're reading, as I mentioned, you have to relate it with the answer options as well. So is to praise staff who has been following sharp protocols, is to reduce frequency for future sharp harm to staff, is to remind staff the risk of working with sharp. So 3 different options. 1, praise staff. That means to motivate them. 2, reduce the frequency. That means whatever the injury that is caused, to reduce it. 3, is it reminding the staff about the risk. So remind, praise, reduce. Those are my keywords. Now reading the paragraph. Don't skip anything, okay? Hospital bulletin board safety alert communication. So the strategy is called elimination method. Now in order to do elimination, don't search for elimination. As you read, eliminate the answer option. That's how you have to practice. Now situation. They're bringing the context. Why? So last week, there were 4 reported sharp injuries at the medical center in a 6-day period. So this is what has happened. In comparison, 80 sharp injuries in the previous calendar year, about 1 to 2 per month. So now this has happened what? In 6 days, 4 reported. Before it was 1. So nothing to do with any of the given answer options. So background. Although we have gone many weeks without employees lost time injury, sharp injuries can potentially serious events. So they're saying, okay, although we didn't have, it can lead to potential injuries. Assessment, how are you going to do that? Still nothing to do with that. A thorough cause analysis investigation completed with staff involved, the air managers and the occupational health and safety team revealed that each of these injuries were preventable. So what are they saying? This could have been prevented. Okay. Now, what are they saying? They're giving some recommendation. First, verify and validate. Verify that safety features available on shaft are fully engaged before transporting or discarding a needle. Complete a visual check and listen for the click. So is this recommendation for praising the staff? Not necessary. Is it to reduce the future? Yes, it can be, isn't it? So maybe. Is it reminding the staff about risk of working with staff? It's not reminding anything. It's just reducing how to. Yeah. Now reading the next. Star. Make sure your fingers are not in the path of a needle when holding soft tissue for injection. Again, is it going to remind the staff about the risk of working, or is it going to talk about how to reduce? Again, it is slightly pointing into B. Reading the next. Seek help. If required, obtain assistance from a co-worker before injecting a patient. So again, these are all for reducing. It's not reminding about what are the risks of working with sharps. What risks have they mentioned? There is no reminder. So congratulations for all the people who have got B as an answer, because B is the right answer, because all the recommendation is to reduce the frequency of future sharp harms to staff. So that is why these recommendations are given. So my answer is also B, and B is the right answer because there is no reminder given to staff and there is no risk as well. Neetu MK, good afternoon. Joseph Majish, hi sir, good evening. Tina Anthony, happy. Soumya Joseph dancing, keep on dancing. Achunitan dancing. Rashna Sur is dancing. Why not, isn't it? You have to cherish your achievements. Ebin Waki, happy. Ashwita, happy. Nintu Jose, good afternoon. So, if you have any doubts, please be kind enough to clarify. If not, we'll go to the next one. So be happy. Ramya Gopi, as always. Stars, bouquet. Good enough, good enough. Any doubts with regards to how I have explained, or anything that you want me to clarify? Anything that you're not clear about? Anything like that? If so, please be kind enough to ask. If not, we'll go to next. Yes? Any doubts? No doubts. We're all standing students, I know that. Sarah clear? Okay, fair enough. Ashley clear? Okay, good enough, good enough. Divya dancing, good. Jisha Krishnan, good afternoon. Mumtaz, no. Okay, fair enough. Eben clear? Okay, excellent, good enough. Okay, because there is no doubt with any of our students. Sonia D'Souza is also dancing. So the next thing that we're going to do is we're going to talk about the part A, which I've already shared on the very same page that you're watching, but you will get the first-hand information in our exclusive reading Telegram page. That's where you get the first info about what is the material. Now, in order to get into the Telegram page, there's a scrutinizing policy. Now, why we have kept that scrutinizing policy? You know, there are a number of fraudulent people available, isn't it? Literally, I call them leeches. They literally feed on somebody else's hard-earned money. So be aware of it. In order to reduce those, we have kept that scrutinizing. So if you want to get into our reading exclusive Telegram page, our admin will ask you to send certain details. After double checking only, we'll be accepting you into that group. Sonia clear, Tasha Tom clear, Anita clear, Renita clear. Okay, fair enough. So are you all ready for today's part A? If so, tell me what is today's part A and how you felt about today's part A. That how is very important because that's how Neetu Madam will frame the next day material. So please be kind enough to tell whatever, however you feel, whatever that you want to let us know, please be kind enough to comment. Okay, we'll be happy. I'm a person who always believes negative criticism, even if you have, I welcome it. Why? That's how you grow. Soumya Joseph part A, thrombolytic therapy, tricky material. Okay, the first review I get is tricky Mumtaz thrombolytic therapy. How you felt about the material. That's how is very important for us. Fair enough. Give me your valid feedbacks. How you felt about today's material. Whether whatever. So the first review I have got is tricky. Akila is also supporting, saying that it is tricky. Fair enough. So the general expression that I get or the ideology that I get is a bit tricky, is it? Limilu is saying easy. Okay, fair enough. So easy and tricky. Anita Prabhu is saying easy material. Okay, fair enough. Sarah Rennie is saying thrombolytic. 1 to 7 is tricky. Anita Simon. Fair enough. Easy material, Kavita. Renita easy. So easy is more now compared to little tough Mumtaz. Okay, fair enough. Asha Tom is saying tricky. Alright, it's a mix of not very difficult, Ramya. Okay, fair enough. Easy material, Divya. Biji Sri saying easy material. So it's a mix of all over, isn't it? It's a combo of all those things that you can get. Biji Sri easy. Alright, good. So now I have got a gauge about what you are talking about. Now let's go and see what part A has in store for you. Now the material will be popping up on the screen. As soon as the material pops up, we'll be talking about how to deal with part A. Now part A, you always have to remember, it will be the first material out of reading that you get. They'll only give you part A material and do not touch the material until they say so. Preeti Shah is saying tricky. If you touch the material, they will not publish your result. If you touch the pencil and start looking into, Sonia is saying tricky material. You're not supposed to do any such thing. When they tell you to start, please start. When they tell you to stop, please stop. Don't do anything unwanted because you always have to remember. I always tell my students, you have to always remember the opponent is more stronger than you. There's nothing that you can do anything. If they say you have done some malpractice, you have done some malpractice. There's no second thought about it. That's why you have the invigilators or the examiners there. So when they tell you to start, please start. That's the time that you touch the material, you touch the pencil, open. When they tell you to stop, please stop. And that's why we push our students to reach that time on or before. Right. Now, what is the strategy? What are the things? What is the purpose of part A? See, the purpose of part A is, are you able to locate specific information in quick time? In order to do that, they give you 15 minutes, 20 questions. Okay? So that means roughly about 45 seconds per question. That's a bit challenging if you don't have a right strategy. So what is the strategy? The strategy of part A is called skimming and scanning. Skimming means quick look. Scanning means detailed look. So what are you to do in this during the skimming? First you have to skim. So during skimming, so how much time you take? You can take about 1 to 2 minutes. But I say take 15 seconds per text. You have 4 texts based on one common theme. So here the common theme is thrombolytic therapy. So each text will be different to each other. That difference, if you can identify, that's easy for you to get the answers. Now I'll show you what are the things that you have to do when you're skimming. So when you're skimming, you're going to underline the key words. Now this is going to show you how to skim. Skimming doesn't mean that you read word by word. You read every sentence. You quick read it, understand the overall gist about it. And as you do that, you underline certain keywords. So I'm just going to show you what are the keywords. So Thrombolytic therapy is called thrombolysis. Is used for the medication to dissolve blood clots and thrombolysis. Reduce damage in the organs and to tissue. It's called improved blood flow. Healthcare providers may use thrombolysis as an emergency treatment if you have an acute abnormal blood flow, heart attack, stroke, diabetes. Blood clot, pulmonary embolism. Thrombolytic can also help dissolve blood clot in the DVT, peripheral artery PAD, and other conditions. They also treat blocks in the coronary arteries, heart attacks, and stent surgery, not an option. So clot inside the blood vessel, thrombosis is used by this therapy. Now I know these are the conditions that is needed. This is what they do, all those things. Now text B. So this is for a scheduled procedure. Use catheter-directed tone. So what are they doing? During the procedure, they give you a sedative to relax you, use local anesthetic, numb the area, catheter, make small incision, neck, groin, arm, body, knee, then close to a vein, put the medication into and blood clot, and they may use them at the end of the catheter, and medication both me. The medication used up to 2 days of work, and the hospital blood clot, looks for the narrowed areas, vein nerve close, your team can open these areas, angioplasty or stent. Remove the catheter during the procedure. This will go in sterile plug. When the medication will work on the line, your team uses the X-ray to monitor the blood of chest, the heart, lungs, and watch this plug 48 hours. The clot dissolve. Now see text C. Absolute contraindication, relative contraindication. So throughout, contraindications are mentioned in C. After that, you go to D. The main risk, again, risk of thrombolytic is internal bleeding. 5% of thrombolytic have the major bleeds, and 1% have the cause stroke, other risk, allergic, blood, nose, stool, or urine, bleeding, bruise, IV, catheter, kidney damage, low blood hypertension, angioedema, ventricular arrhythmia. After this, after skimming this, you're going to go to the question. Now, these 20 questions are divided into 3 types of questions. Okay, so these 3 types you are expected to by heart along with the types of question and the instruction that is there. So if you really look into question number 1 to 7, these are called match the following question, where the instruction clearly says you are expected to write any of these letters A, B, C, D, and you may use any of these letters more than once because it is 1 to 7. Okay, so this instruction and type of question and all those other things should be by hearted, and then you're going to go underline the keywords in the question as well. That's how your strategy is. You're going to refer the keywords only. That's the only way that you will find answers. Don't try to comprehend or infer answers. The prevalent conditions treated through thrombolytic therapy. So where are they talking about all the conditions that is spoken? So definitely it's there in 1, isn't it? Throughout the whole thing, they're talking about heart attack, stroke, coronary heart attacks, all those things, deep vein thrombosis, PAD, other conditions. So the answer is very simple. It is A. Now the next thing, time frame, that means duration, how long for the medication to work during the thrombolytic therapy. So how long procedure? So it should be there somewhere during the therapy, isn't it? So the answer should be somewhere in B. I'm just giving a wild guess. Now is there anywhere in there? If you really look into, they say it takes up to 2 days to work the medication. So the answer is B. So this is why I said keywords are very, very, very important. Who does not qualify? So does not qualify for as a suitable candidate. So definitely, where are they talking about all these? It should be there in C, isn't it? Contraindication should be there. So who is not? Absolute contraindication. People who have a previous history of hemorrhage, history of dementia, central nervous system, head trauma. So all those things. So the answer is C. That's how easy if you have your keywords. What is the likelihood of patient experiencing a brain bleeding following a surgery? So where are they talking about all these following surgeries and all? D, isn't it? Likelihood of bleeding? Where? 5% of people who may have major bleed, 1% bleed. So that's where the answer is. So D. Impediments, now I like that word, impediments for someone planning to undergo thrombolytic therapy. So impediment, what are they talking about? It's definitely contraindications, isn't it? So where are they talking about all these difficulties, contraindication? Do you really need a second thought? C, isn't it? Absolute contraindication and relative contraindication. So why do individuals opt for thrombolytics? So why do individuals, why do they choose? So definitely it should be there in A, because they choose because it is used to treat what? All these conditions, isn't it? Cancer also dissolve blood clots. Very straight. So organs that may confront bleeding post-surgery. So which are the organs? They are only mentioning the organs in brain, nose, kidney, all those things are mentioning about different organs that is there before confronting to bleed. So that's the answer D. Now that's how you get 1 to 7. Now the next question. Vinita asked 8 to 14. So these type of questions are called short answer question, where your instruction clearly says it can be a word, number or numbers, or both. Word or numbers or short phrase. These short phrase can be anything between 2 to 3. Okay. Now in this case, you are not expected to rewrite the same word that is given in the question if it is there. Soumya, Renita, Uttam, 7 out of 7. Akila, 7. Absolutely good enough. Keep it up, keep it up. Good, good, good. Now, although the question type changes, the strategy doesn't change. You're going to do the same thing. Anita, 7. Excellent. Mumtaz, 6. Now, at what systolic? Now, see, the word systolic is there. So, where are we talking about? Systolic. Blood pressure, all those things. So, where are we talking about? So, systolic blood pressure, Kavita 6, Anita 7, Lumi 7, Rini 7, Divya 7. Okay, very, very good. So, systolic, Nintujo 7. Systolic blood pressure, threshold. So, threshold is another word where it is, which one? It's the level, isn't it? It's all those things are being spoken about. So, Vijay 7. Patient deemed ineligible. Now that ineligible is a big word. Ineligible for thrombolytic. So what should be the measure? So where are they talking about? So systolic blood pressure is there. So what is that? Greater than 180 mmHg. That is, the question is at what systolic blood pressure threshold? That means the level. Okay, greater than 180 mmHg. Good enough. So which procedure employs a catheter and device to break up the suction, the clot? So where are they talking about all these procedures and all during the surgery, isn't it? What are they saying? So they may use a device at the end of the catheter to break up or suction of the clot. What is that called? Mechanical thrombectomy. So MECHANICAL THROMBECTOMY. A BS7 absolutely good enough. Now the next question. What medical condition elevates the risk of kidney failure after thrombosis? So after means definitely go to D. Now there should be a condition which elevates the kidney damage. So kidney damage, especially if you have diabetes. So the answer is diabetes. DIABETES is the answer. So again, which condition mark the occurrence of blood clot in lungs? So condition, blood clot in lungs. So where are they talking about all these? That's definitely in one place, isn't it? They're called pulmonary embolism. So stroke or blood clot in lungs is called pulmonary embolism. PULMONARY Now what is the major? I love this word called jeopardy. What is the major jeopardy linked with thrombolytic therapy? Jeopardy means increased risk. So what is that? Significant risk and all those. Jeopardy putting at risk. So what is the risk? The main risk of thrombolytic therapy is internal bleeding. So the answer is two-word answer. INTERNAL Now what is the maximum? Now see, maximum duration it takes for the clot to dissolve after the administration of medication. So how long does it take? So the maximum duration is the question. So the maximum duration is mentioned again. It is 48 hours. Okay. So the maximum duration is the question. If you write up to 48 hours is wrong, because the question is what is the maximum duration? The answer is 48 hours. Absolutely good enough, Soumya. Very good. That's why you should underline keywords. Mumtaz is good enough. So what is employed to dissolve blood clot? So employed to dissolve means what is the therapy done in order to dissolve? So where are they talking about? So thrombolytic therapy is used and it uses medications to dissolve the blood clots? So the answer is a very simple one. Medications. MEDICATIONS. A lot of people have got 48 hours. Absolutely good enough. Asha, 48 is wrong. 48 hours should be there. Akila got 48 hours. Abhiya 48 hours. Reshma 48 hours. Vijayashree 48 hours. Good enough. Good enough. Now, the final set of questions. Again, these are called fill in the blanks question, where in this case, Vanita, what you have asked, in this case, repetition of article is also a problem. In short answer, article is not a problem. But in here, article is a problem. Not only article, if you are writing the same word which is already there, then it's a problem. Okay, now the instructions remain the same. Word, number, numbers, both short phrase. It's very similar. Now the only thing is redundancy. You have to be always cautious about. To assess the efficacy of clot dissolving medication, dash results are employed to monitor the progress. So where are they talking about all these? During the surgery, isn't it? So I know that it can take up to, so while the medication is working to break the blood clot, your team uses X-rays to monitor its progress. So the answer is a hyphenated word which says X-rays should be the answer. Now, dash might be the ultimate outcome. Ultimate means final outcome of brain bleed. So where are they talking about brain bleed? It's there somewhere in D, isn't it? Now let's see. Occurrence of complication post-thrombolytic. So what is the ultimate complication? So bleeding is there. So what happened? These people have major bleeds and 1% have brain bleeds. So brain bleeds is the keyword. So what is the complication? Stroke. Stroke is the ultimate complication. Very good. Enhancing blood flow. That means you're enhancing the blood flow, minimizes the damage to organs and tissues caused by clots. So with the enhancement of blood flow, what happens? So the answer should be, where do you get that answer? You get the answer. Thrombolysis reduces the damage to your blood organs, tissue, which improves blood flow. So thrombolysis. THROMBOLYSIS is the answer. Question 18. Thrombolytic therapy is effective in dissolving blood clots linked to, so somewhere it is linked to peripheral arterial disease. So I know that it is paraphrased or it is abbreviated, not paraphrased, abbreviated as PAD and various other ailments, so other conditions. So where are they talking about all these conditions? PAD, all these, again, A, isn't it? So they're saying, so dissolved blood clot, DVT or deep vein thrombosis, peripheral arterial, so PAD, other conditions. So all the others are mentioned. The easiest to write is DVT because they have given the abbreviation in the text. If they have not given, then try to write deep vein thrombosis. Good enough. The penultimate question for today. After the surgery, now let's say after the surgery, patient happened to witness a condition of swollen tissue. So after surgery, where? Go to D. So swollen tissue, where are they talking? Swollen tissue. What is a condition called? Angioedema. ANGIOEDEMA. The ultimate question today. Patient with recent dash within 3 weeks, not eligible. So 3 weeks, not eligible. It should be there somewhere in C, isn't it? 3 weeks is there. Relative recommendation. So traumatic cardiopulmonary resuscitation. So it's a bit of a bigger word construction, isn't it? TRAUMATIC CARDIOPULMONARY RESUSCITATION. So I have wrapped my 20 answers. It's high time that if you have any doubts, please do clarify. If not, do shoot your total scores. I'm sure that most of you have got the answers right. But still, it's of course, we are here to learn. Learning is a process where you make mistakes and we are here to correct you. Once you are corrected, don't repeat the same mistake. You make another mistake. Fair enough. We are here to correct you. Soumya 19, absolutely good enough. Renita 20, very good, stunning. Keep it up, excellent. Good enough. Akila Sham 20, absolutely good enough. Good. So 19, 20, 18, Divya, excellent. Keep it up. Anita Prabhu 19, absolutely good enough, excellent. Abhiya 20, stunning. Keep it up. Adira 19, very good. Keep it up. Kavita Balaji 18, absolutely good. Keep it up. Mumtiz 19, very good. So all of you are there. Uttam Kumar 19, good enough, keep it up. Asha Tom 19, good enough, good enough. That scores that you're saying. 18, 19, 20. Anita Simon 18, Bitty Sri 20, stunning, keep it up. Reshma Abraham 19. See, you have to come out and say, I have got this. Not for anyone, for yourself. Alfina 19, good enough. Linny 19, excellent, good enough, keep it up. Sonia 17, very, very good, keep it up. I always love those students who have that courage to say, whatever that score, doesn't matter whether I score the highest or the least, you have to tell. Good enough, so I couldn't see anybody asking any doubts. Is there any doubt with regards to any of those questions? I'm sure that you don't have any doubts, isn't there? Right, since you don't have any doubts, it's high time that I know that you're all busy people. So until and unless I see you all tomorrow, adios from me. God bless you all. Take care. Bye.